Good evening, everybody. Welcome to another Hatch Global event. We have Esther Dyson, and I'll talk a little bit about her soon. My name is Nathan Sivagananathan, co-founder of Hatch. Hatch is a place for innovation, growth, and collaboration. It is a center of gravity for all things startup. Hatch is the home for hungry entrepreneurs in Asia. And the vision of Hatch is to transform the business culture by providing genuine opportunities for entrepreneurs to experiment freely, acquire knowledge, collaborate deeply, and thrive successfully in the community. We build spaces that encourages budding entrepreneurs to incubate, collaborate, and accelerate. Today, our partners, BYLC Ventures from Bangladesh, was created to help passionate young founders get kickstarted with their big ideas. They do this by providing technical support to validate a product or solution and seed funding to go fast to market. They also provide a set of acceleration support, including a plug-and-play commercial space to work from, customized business training from successful CEOs and mentors, and a suite of professionals to really support them in the legal, accounting, and corporate governance. Today, we're co-moderated by Faraz Khan from Pakistan, and Faraz is going to give a background to Seed Ventures and Pro-Pakistani.
Thank you, Nathan. It's an absolute privilege to be part of this discussion and co-moderate that with you, with Esther. So we represent Pro-Pakistani. Pro-Pakistani is Pakistan's largest independent publisher for tech, business, and other news, with 136 million traffic on this site to date. And Seed Ventures is one of the largest ecosystem developer in the impact space in Pakistan, from policy legislation to developing intermediaries and micro and nano investment opportunities for bottom of the pyramid and grassroots entrepreneurs across Pakistan. And we're very excited to have Esther. Specifically, I'm very keen to discover and understand the impact side of her work, across the world. And I think the audience in Pakistan will be very, very keen to actually listen to that. Thank you, Nathan.
So to introduce Esther today, Esther is no stranger to Asia. She's been to Sri Lanka, she's been to India many times. Esther is the executive founder of Belleville, a 10-year project to nudge society towards long-term and equitable thinking by showing that social and financial value of investing in health for all. She's a serial entrepreneur and investor in many companies. To name a few, MedStory and PowerSet sold to Microsoft, Delance sold to Google, Geometric Intelligence and Jump sold to Uber, Flickr and Delhi ICIO sold to Yahoo, Brightmail sold to Climatech, Vizu sold to Nielsen, Basic Science sold to Intel, Eventful sold to CBS, SquareTrade sold to Allstate for 1.4 billion, and Init AI acquired by Apple. You can see that she's also an astute businesswoman. She has exited so many companies and continues to invest in many more, and specifically around the health sector. She's also served on the boards of 23andMe, Meetup, and WPP. Esther, welcome to South Asia and welcome to Hatch Global.
Good evening. Nice to be here and good to see you again.
So Esther, I mean, you've done so much all around the world. And the one thing that always stands out about you is your training to be a cosmonaut in Russia. Why did you do it and what did you learn? And what's the love for space travel, i.e. space adventure is an organization you're involved with? Is that what motivates you?
It's one thing. My parents were scientists and my father actually was an astrophysicist. So he studied space. He co-designed a spaceship back in the 50s when I was a kid and worked with NASA. He didn't work for NASA, but he was, part of a lot of different commissions. So for me, space travel was just, well, when I grow up, that's going to have happened. And so I didn't think it was particularly interesting. I just figured my dad would take care of it and someday I'd go into space. And then once I had grown up, I realized, oh, it hasn't really happened. So I got more interested, invested in Space Adventures, which is the company that has basically been the travel agent for the, I think it's 6 or 7 actual space tourists. And they said to me, you know, when you make your first 100 million, you can spend 40 million of it with us and go into space. And I said, yeah, great, I will. But in the meantime, they said, if you want, you could train as a backup, but that's like a 6-month. So I said, never mind. And then in 2008, I was extremely busy. I was trying to plan a meeting. You know, there's another meeting. I was going to be one. And my sister had discovered she had breast cancer just a month or so before. And she's now fine, or I wouldn't tell the story. But anyway, I was on this phone call and I thought, you know, I wish I had breast cancer, then I could cancel. And I thought, that is crazy. You know, something's wrong here. And I decided I should take a 6-month sabbatical and see, did I really like my life? Because if breast cancer is a good option, that's crazy. Better to go into space. So I ended up becoming backup to Charles Simoni from September of 2008 to March of 2009. I lived in, so the US government would never let civilians go into space. Yeah. The Russians, it's impossible.
My child.
How much? And anyway, so the Russians will negotiate anything. And that's how the Space Adventures business model works. So I trained in Russia for 6 months in Star City outside of Moscow. And basically the idea of the training is to make you feel, when you first go into space, that it's completely familiar. You've studied everything, you've done simulations, you've eaten the food, you know how to do everything. And that part really worked. When I watch a movie about space, my emotional reaction is, yeah, I've been there. And then, oh no, you haven't. You've just done the training. Anyway, it was great. And in some ways it was a good preparation for coronavirus. I lived in the same place, had almost no jet lag, though I did take 3 trips during the 6-month stretch back to the US. And I also took weekend trips to Azerbaijan and Kazakhstan. And it was really wonderful. I speak Russian, I should mention. So anyway, but at the end of it, I was very happy to come back to my regular life.
That sounds so interesting, Esther. So all of these guys, the billionaires in the world, are all battling to be the first to launch the first commercial flight to the moon. So who's your money on?
I actually do have some money invested in him. It's Elon Musk.
Elon.
And you know, but I've known Jeff Bezos because I came out of tech. I also know Jeff, and he started a little later, but he's not a bad guy to bet on either.
And you know the other guys as well, Richard Branson and Shamat, obviously.
Yes.
As well.
Yeah.
That's great to hear from you. So one of the biggest things that you've been working on, and I think, you know, I've been really motivated by what you've been sharing over the years, is that you always say, don't rent your health, invest in it. You're changing the system with Wellville. Can you talk about what is Wellville, what made you start it, and how you've done with the 5 communities that you're working with?
Okay, so Wellville is a 10-year nonprofit project, and each of those words is really important. First, to cure a disease, if you have the right drug, you can do it in weeks. But to actually make somebody healthy takes a long time. And 10 years is a huge luxury in the healthcare world. But it's, you know, it's half, you don't even get through childhood in the real world in 10 years. So it's absolutely necessary to show a real difference in health as opposed to a cure from a disease. Second, it's nonprofit. Right now, there's no business model because it takes too long, and the investment is not actually into healthcare because people don't become obese and addicted and get hypertension and so forth because of a lack of health care. It's conditions that create that disease that then require the health care. But health depends on good food, good parents, nutrition, exercise. You know, it's bad health is very much a disease of poverty. It's not unique to poverty, but if you're poor, it's so much harder to be a good parent to your children. It's hard for the children to get nourishment, to get education, to get good habits, and simply to have the emotional security to take care of themselves properly. So we wanted to, I wanted, you know, people know this in theory, but they don't seem to act on it. And the reality is, economically, for society, unhealthy people are a huge cost because they make employees unproductive. They make people turn to crime, so they go to jail. You know, the costs of bad health are huge, but they're paid more by society than by the individuals. So the challenge is you make the investment as a society, even though it seems that the beneficiaries are, in the short run, the beneficiaries are individuals. In the long run, it's everybody. So what we're really trying to do is demonstrate with stories and examples and so forth effectively enough that we can actually be part of changing public opinion and the kind of policies they vote for. So it's also a project because our goal is not to scale Wellville. Our goal is to work in these 5 communities and then to scale by having other communities do the same things. So that's the fundamental idea. What happened was in 2014, I started this thing with money from some of those exits you mentioned. And my CEO and I put out a call for applications from US communities under 100,000 people that were self-contained that wanted to do this. And to our amazement, we got 42 of them. We visited 10 of them. And that, you know, my whole life I've spent being educated, whether about space travel or Wall Street or the tech industry. For 25 years, I wrote a newsletter, which was basically focused on educating me, and then I told other people about it. So this too was an amazing education. These places mostly had a few rich people and people well off enough to be running things, and they were the people who applied. And then in the US in particular, kind of a vanished middle class, and then a lot of poor people. So that, and the poor people were often unhealthy, obviously poor, bad schools, etc. So we picked 5 of the places, and the business model is basically we don't hand out money. So they're not trying to tell us things are okay, give us more money. They tell us the truth, but we don't ask for money either. So we're basically like a coach for a sports team. It's the team that owns the ball. It's the team that actually plays the game and wins the victories. And what we want is not to give people fish, not even to teach them how to fish, but to help them build their own fishing schools that are sustainable and that have enough scale that instead of lots of little NGOs competing, you have things working at scale to make the community a healthier place. So we talk not just to the healthcare system, which to some extent comes into play too late. It's the schools, the YMCA, the gyms, the local food organizations, the transportation systems, all these kinds of outfits to help make the communities healthier places to live. And we're 5 years in.
Sorry, go ahead.
That's it.
No, I mean, how do you go out and convince these people? I mean, you're talking about restaurants, you're talking about the community. businesses
No,
there?
we are advisors to the people who brought us in. So at least in theory, they want to listen to us. Though there are lots of people who ask for advice and then don't listen. I mean, in the world at large as well. But I would not be very useful walking around one of these communities telling people to eat better, or even showing them healthy food. It's like I'm an outsider, and I remain an outsider. So we work with the local people. They work with the restaurants. They're the again, the community needs to own it. If it's some nice white lady showing up, yeah, it's nothing's going to change. So it's very much, again, giving advice and counseling and helping connect them to resources, because they do need money. It's not coming from us, but we'll help them discover places they can get grants. Or in the US, there's always various programs and legislation that you need to take advantage of if you know about it. But in these small communities, people don't. For what it's worth, there's a wonderful book called Good Economics for Hard Times by Abhijit Banerjee and Esther Dyson that just came out a few months ago, about precisely this problem of, why doesn't the market work? Why don't poor people go get the jobs that are available 2 cities away? Why don't people take advantage of all the government programs? Why? It's because the world is full of friction, and the economist world is friction free. So we help to deal with that friction, which is especially severe in the small communities.
And what has been the impact and the results that came out of this endeavor?
So originally we thought we would just measure transitions to diabetes and look at all these medical things. And at the end of 10 years, we do hope to see some movement, but it's a very slow process, because you need to help people think differently, just like an entrepreneur. You're somebody who grows up on a very small family farm dreams about buying the neighbor's farm or marrying the neighbor's daughter and then connecting the farms. And you have to think about generations. You have to think much more long term, but you're so busy with the short term. So we're trying to help them think longer term. And I mean, one of the best examples is there's a diabetes prevention program in Muskegon, which is one of the communities, which is the one I work with. We're a team of 6, 5 of us. Each one has a community, and mine's Muskegon. So Muskegon has 180,000 people. They're a bit larger than they were supposed to be, never mind. And that means they probably have 30 or 40,000 people who are pre-diabetic. So the YMCA, this little kind of community sports center, started a diabetes prevention program. And they had, I think, 1 or 2 coaches. So maybe 5 classes at a time for half a year of 10 people. And I said, well, imagine you had enough money. What could you do? And they said, well, we could hire 2 more coaches. And that's not going to deal with the problem. It's going to. And so I said, but what could you if you actually had enough money to solve the problem? Anyway, with that kind of pushing, they went and they got a grant for $3 million from the Centers for Disease Control. And now their program is growing. They've done about 1,000 people. Right now it's online, as you can imagine, but it's that kind of thing. The school is offering free breakfasts to the kids because so many of them aren't getting fed at home.
So inculcation and inception are the cornerstones that actually trigger very slow but sustainable change.
Yes, exactly. So one other problem, as you can imagine, is drugs, people addicted to drugs. And ultimately, drug addiction is a disease. It's sort of similar. You're short term and I need this drug. That's all I need. It's just, please And you take the drug, you feel better for a bit, and then, but nothing changes. And so many of these community organizations are the same. You know, we have 3 part-time workers. We need to get a grant so they can do something. This year they'll do science classes for high school seniors. Next year it's dance classes for old ladies. But we never actually changed the environment. And so we're trying to get the money to go to longer term projects and to encourage these little outfits to work together, because each of them does not have enough scale, is not sustainable.
Right.
And they're addicted too. They're addicted to short-term grants.
Got it. Let me ask a question, kind of stepping back and more towards the macro side of it. Yeah, I mean, your in-depth experience in tech and digital transformation, and keeping this post-COVID era in mind, do you think the pace of individual and institutional digital transformation that is taking shape right now would turn into a systemic change? And if yes, what would that mean for our future generation?
Well, one thing that's clear is many, many more people are going to do many, many more things online. And that was, you know, everybody was saying, well, you know, I think we just need to wait for the young people to get older. But now suddenly the old people are using this stuff and businesses are using it. And everybody, I mean, it goes back to good economics for hard times. Everybody kind of knows that it's cheaper to work from home, but nobody gets around to it. There's too much disruption. But now there's so much disruption that these things are easy. And some things, you know, people want to go back into bars and sit around with their friends, but they don't really want to go back into traffic jams and getting up at 6 a.m. so they can be at the office at 8:30 in the morning. And, you know, certainly there will be travel. It will be much more expensive as they put in sanitation measures. And it will also, it'll be looked at much more, again, if you like, economically, as, you know, why is this person spending 8 hours traveling for a 1-hour meeting?
Yep.
And so if you like, the trade-offs will change dramatically. And there will still be travel where it made a lot of sense. And in the middle, a lot of travel will go away. And then there will still be, you know, the travel that made so much sense, the online that made so much sense, it had already started. In medical treatment, the same. Yeah, I really don't need to have someone come into my doctor's office to talk about my emotional problems, or, you know, I can test my blood at home and then have the doctor give me advice or write a prescription. So that partly depends on regulatory changes as well in the US. But there's going to be a lot of people who will have experienced telemedicine, who, it reminds me of a story about, in Stockholm, they had these bridges and they changed the rules about who could use the bridges when or something. And before they made this change, 80% of the people voted against it, but somehow the government got it through. Maybe the numbers are wrong, but it's something like that. 6 months after the change, they surveyed people, and 80% said they liked it, and 70% said they had voted for it. In other words, even their memories of what they thought had changed. And I think we'll see something like that.
We have a lot of people listening in from Bangladesh, Pakistan, Dubai, Sri Lanka, India, and Singapore as well. So whoever's joining in, please feel free to drop a question and say who you are and where you're from as well. It'd be great to hear some questions from you. So Esther, ever since I've known you, you've always had 2 wristables. I remember you having the first one as a Misfit Shine, and you're an avid swimmer, and you used to always come into meetings after a good swim and used to tell us sort of get these wearables. So the wristables wearable world, it's all about monitoring. And why is monitoring so important in better health?
Well, it's because precisely this time problem. Yeah, if I quote do the right thing for my health, it takes months usually for me to notice. If I get a good night's sleep, yeah, I'll feel better this next day. But it's very hard to. It's not accurate or concrete or quantified, and so these monitors change your mindset because you can see each day, did I sleep better or worse? And did I run farther? How late did I go to sleep? And so they're both monitors, but they're also in a sense reminders about the behavior you're trying to change in yourself. And they're great if you have the money and the time and the capacity to do the right thing. They don't solve the problems of the people in Muskegon who are short of time and money and don't have the facilities. They can't afford to go to the gym. They have to take care of their children. But if you're above a certain level of economic subsistence, they're very helpful in understanding your behavior and keeping yourself healthy. So, the hope is that more and more of the world will be at that level where they can actually make use of them.
And have you found it beneficial? I mean, you were talking to me earlier and you were talking about the 6 different devices you're using, the sleep monitors you're using in your life, and how has this really impacted you throughout the last 10 years?
Well, it's interesting. First, obviously, I'm a bit of a quantified self nut. And, I've been doing this for a long time anyway. I've been swimming every day since I was 18. Though right now I'm using a rowing machine because my gym is closed. In a sense, what's interesting is some people will wear a piece of jewelry with their mother's picture on it, or a wedding ring, and this ring, it's a meaningless piece of metal, but at the same time, it somehow helps me to leave dinner before dessert, to go to sleep. It's kind of a reminder of I want to be a healthy person. The irony is, since before I knew you, I probably traveled 250 days a year. And I am experiencing jet lag free life, except for that little bit in Russia, for the first time in those 40 years. And I'm sleeping amazingly well. And, all those years of traveling, it was pretty obvious I would sleep well after I'd been somewhere, being in the same time zone for a week. But, it's not magic. And interestingly, I'm probably healthier right now than I've ever been with this regular bedtime. It's amazing. And, I'm sure my behavior will change too. I'm still going to travel. I'm looking forward to coming to Sri Lanka or sometime soon, and London and California and Muskegon. But at the same time, I too will probably travel less. But just one other thing about these devices, they all move in the same direction. They don't agree. They will agree, oh, you slept a lot or you slept a little, but the details vary. And it kind of shows how complicated health is. It's not a single measurement. It's not just your BMI or your heart rate. It's how all these things interact, and understanding that is still complicated.
I see. I mean, you invest in so many health companies, and I don't even know how many companies in your lifetime you've invested, but it's got to be over a couple of hundred companies that you've supported, especially in the health area that I know. Which companies are you really excited about that you've invested in? What do they do? And it doesn't have to be invested in, but who you're admiring at the moment? Because when this whole thing started, Nike went into it with a wristable at that time, and then everybody thought Apple would come in immediately, but Apple waited and came in later, and some of the results we're seeing from Apple Watches are really interesting. So are there other devices or other monitoring mechanisms that you're seeing that will really help in this current COVID environment? And secondly, with COVID, has technology been advanced?
Okay, the devices they're here. Some of the sleep monitors I use are still kind of in beta. They're interesting, but the real challenge is behavior change, not just behavior monitoring. And one of the companies I'm an investor in is Omada Health, which is diabetes prevention. There's Sleepio, which is sleep, and they're all kind of expanding to sleep, nutrition, kind of calmness, meditation, self-awareness, whatever. The real challenge is we also need to change the food supply in the US and start taxing sugar. I mean, sorry, it's very controversial here, but it really is the only solution. And we should tax sugar the same way we tax carbon, because the consumption of sugar imposes a huge cost on society at large. And it also will help in behavior change because it will make sugary foods more expensive, which is good. I'm invested in a couple. For us, you have a question, or you suddenly appeared? I'm invested in a couple of companies that deal with opioid drugs. One is a medication-assisted treatment company called MedicaSafe. I'm invested in a whole bunch of companies that are focused on, again, user behavior, trying to figure out how to make that useful for people who don't have, who are not just the rich who have a lot of time, but helping to make this stuff more accessible. I'm an investor in a bunch of drug discovery companies because I love the science, and various kinds of insurance. To me, insurance is kind of so in the United States back in the 1920s, the fire insurance business started. And I mean, it started before that, but the thing that changed was instead of getting paid if you had a fire, there would be inspectors who would come and instead of spreading the risk, they would reduce the risk. And so they started inspecting if your building was safe. And I just was talking this morning with someone who, a company I'm invested in called Coffee Labs, which is focused on trucking insurance. And their rates are lower if you use modern trucks that have various safety devices and so forth and so on. And so the insurance is the business that actually thinks long-term of that risk, but also about how do you reduce risk. So I actually think insurance is a really interesting business. Health insurance should be an interesting business, and I'm an investor in a couple of them, but the market is so regulated, it's hard to really do something very innovative.
So we've got questions flowing in.
Great, okay.
Let me start with the first one. It's from Ganesh from Sri Lanka. And the question is, if there is a massive conspiracy theory on the bad pharma, what does Esther think about this, especially in the COVID world? And how much value should we place on this in making health decisions?
So there's a conspiracy theory about what?
Bad pharma.
Okay, I mean, there's lots of conspiracy theories, and there are indeed a lot of, I'm in the middle of reading a book called Pharma about the Sacklers and OxyContin. And yeah, the pharmaceuticals business is full of people who are trying to make money. And a lot of companies have done evil things. On the other hand, a lot of companies have created wonderful modern drugs. And, it's, some conspiracies are not theories, they're facts. But a lot of the stuff now is completely bogus, including, there's a lot of fake tests and so forth and so on. But at the same time, there's a real need for the best of pharma to produce a vaccine that works, to produce tests that work. And so, I mean, fundamentally, you need to be careful where you get your information from and where you get your medicines from. It's precisely because it's such a big and necessary business. It's full of people who are basically trying to cheat the system and don't care at all about the people they sell their products to. But, you know, pharma regulation is the beginning of the answer. And I mean, in the end, we'll never solve the problem of people being greedy and doing bad things.
Right. Thank you. That's useful. Let me just take one more before we come back to our conversation. Murtaza from Sri Lanka again, who's been working in a company. Wellness wants to know two things. One, how long you take for the healthcare industry to really move from curative to preventive. And two, people are not willing to pay for prevention or for digital health. How does one measure value creation in digital wellness?
So I don't think the healthcare industry is really going to move to prevention. I think it's ultimately it has to happen. You know, there are parts of it. Healthy mothers, maternal care, that's healthcare. But healthy childhoods, it's child care, it's schools, it's the community. It's the social problems that make people sick. And, you know, it's good if doctors tell you to be healthy, and they should. But fundamentally, the problem of poor people being sick is not a problem of the healthcare industry. It's a problem that creates an excessive need for healthcare. The second one, you know, there's a lot of social change. And one thing that's COVID-19 has made so clear is if you are unhealthy, even if you don't know it, if your blood sugar levels are high, if you're hypertensive, if you have a whole lot of pre-existing conditions, you are at much greater risk. You're also at risk if you're poor because you have to do a job that keeps you out in the community. But your chances of dying if you get the disease are much, much higher. And so suddenly there's the personal economics have changed. People say, oh my God, I don't want to, you know, and first there needs to be a coronavirus, then you need to get it. But still, it definitely changes the calculation, and it's causing much, much more attention being paid to, is this person fundamentally healthy or not? And so I think that's going to be one of the good things that comes out of this pandemic, that people will understand it's not enough just to take a pill to stay healthy. You really have to be fundamentally healthy. And it's, you know, again, society needs to change around you. The food in the schools needs to be better. The food needs to be healthy. There need to be more gyms for people. It needs to be socially acceptable to go running on the street or go to the gym. Or, I mean, one of the biggest contributors to a lot of the substandard health in the United States is people stay up too late, they drink at night, drugs and alcohol are too acceptable. And those things are partly, I mean, for me too, it's like until COVID-19, I regularly had to go to these dinners in the evening, and they're not good for you. I mean, I don't think we're going to suddenly cancel dinner worldwide, but things will change.
Another change that, I mean, the second part of the question, that an experience that I can share from Pakistan's perspective, is that the digital e-health solutions, especially during this COVID environment, the government is backing up e-health solutions, the startup solution, and they're scaling up. And now that is that systemic change that we earlier were talking about, that, I mean, that has been fast forwarded. And the pace of that change and realization of that has come about. I mean, I wish pandemic wasn't there, but that's one good that has come out of it.
One benefit, yes. Yeah, totally. People people who would never have done it before, my God, it works. It's cheap. It's convenient, both for the doctor and the patient. It's, you know, it's like a lot of these things. Of course, people should be using email, but it took 10 to 15 years for them to do that. So yeah, these are two of the big benefits of COVID-19: attention being paid to being healthy, and the dramatic acceleration of telemedicine.
Absolutely.
Esther, just one more question that's come in as well. There are so many natural products out there as well that have not been scientifically proven. How do you decide which companies are worth taking a risk on? Because the claims are not health benefits or medical approvals through the FDA, but just they make the claim that there's a better living.
Yeah. Well, I don't invest in a lot of substances, supplements, because there is a lot of stuff out there, and I have no way of judging if it's any good. I focus more on, I mean, it's my own money. I don't mind taking the risk. In a sense, if one or two deals out of every 10 are good, the other 8 are simply the cost of that one good deal. It's I don't go around, if I went around thinking that all the deals that didn't work were mistakes and I was stupid and I had failed, I wouldn't do anything. It's more like you pay for one investment with 10 investments that you make. And if the one works out well enough, again, it's the cost of your education. It's not mistakes. So I invest in things that might work. I invest in things that excite me. I invest in things that do something I think matters and is important. And obviously I invest in people I like and trust, and sometimes I make mistakes, but it's, in general, I'm not a big fan of products and supplements like that anyway. I'm a fan of fundamental scientific research or behavior change tools. And, I'm trying out 3 of these sleep devices I might invest in, but not yet because they're really not ready.
Esther, just switching over to you as an investor, there is a question out here, which is, one of the things is when you're in South Asia, your medical system is generally seen as not superior to the ones in the Western world. And many startups in this region are trying to disrupt the health system in Asia and also come up with solutions globally. But the biggest problem that they face is that, nobody takes them seriously because it's come from South Asia or Southeast Asia, because they're not in a Western world or European or US organization. So what's your advice to individuals in the health sector who are trying to disrupt in their own country?
I would say don't pay too much attention to the US. It's a huge market, but it's full of people. And, you can look at it and you hear about Omada or about all the big pharmas or, Fitbit. But the reality is each of those has hundreds of competitors that you don't know about. And if you go to the US, you don't have the same connections. You don't have the same network of people. And certainly there are counterexamples. Those are the ones you hear about. But if you can do something for Southeast Asia, that's a huge market. You don't need the US. And I spend a lot of time in Russia. And I say the same things to Russian companies. Don't go to the US. You're a stranger. You sound funny. Yes, Sergey Brin was very successful. He co-founded Google. But most Russians in the US, they're not. It's like work in the market, and there's a lot of countries and a lot of people in Asia, and then who knows what will happen later. But you get a much higher return on your investment in a market where the people, the problems, you actually understand how to sell the product because you understand how people think. And, how shall I say, I'm an international person. I love traveling around, and I don't want to say that's, the last thing I want to do is dismiss someone who has global ambitions. But at the same time, you're much better equipped to solve local problems. And that's where you're more likely to succeed. And if you get very successful, then then you have another conversation. But as a startup, your own market is the one where you have the understanding, the contacts, the context.
And it's just adding on to that question, I mean, you obviously are on boards of companies in Russia, Cairo, other parts of Asia. And you're absolutely right. Whenever I try and get time from you, your calendar is almost 9 months ahead with every single travel schedule on it. So you're probably the most traveled investor that I know. So the question to you is, when you meet all these companies and entrepreneurs in different markets, do you see a fundamental difference in each of the markets, or are they trying to serve the same people, look at the same business models, or is it really different from Russia to Cairo to the US?
Well, first of all, if you're talking about underlying technology, a virus is a virus, as we've discovered, no matter where it is in the world, and so is a drug. If you talk about habits, culture, what it takes to get someone to adopt something, the further you go from the technology or the science to the people's lives and behavior and so forth, the more local it becomes. And yes, people are still people. They marry, they have children, they love people, they get jealous, they're scared. But the cultural context in which that happens varies quite a lot. And this is why I love traveling. And so the reason I joined you at MAS Holdings was basically because you said you would bring me to Sri Lanka and let me look at the factory. I didn't want to see the museums. I wanted to see, how do people really live? And it's such an amazing world, and it is so different. Again, there's this foundation that's the same, but the realities of life, of government, of culture, of living conditions, the assumptions by which people live vary so much. I love to tell people I first went to Russia in 1989, and it taught me so much about the United States, because I'd been to England, but looking in Russia, you could really see what it was like not to be in the United States. And suddenly the things you took for granted, you realize, no, there's places where people don't smile in the stores, and where they don't answer their telephones at work. Because I asked one Russian, why don't you answer the telephone at work? And he said, well, it's because probably it's someone with a problem. I don't want to talk to them about their problem. Whereas an American would say, oh, it's a customer, I'm going to upsell them. So you really learn so much about your own culture by stepping outside that fishbowl.
I'll ask a rather, not exactly personal question, but more a personal perspective. Mm-hmm. You've lived a couple of decades. Which is your favorite time, era, or, and leading from this question is, are we going back to basics?
Yeah. So I used to joke, I'm fundamentally a very optimistic person. I'm cheerful, and that's why I do things, because I think they're going to work out. And if they don't work out, at least I'll learn something, which has also happened. So I used to say, well, I will try really hard to avoid a nuclear holocaust. But if one happens, either I'll be dead, or I'll be busy doing something, and I'll probably be quite happy. And to some extent, that has happened. So in some ways, I'm really happy right now, because I'm doing something useful. There's huge disruption, there's huge danger, but there's also huge opportunity. And it's, there's this annealing when you throw things around, they tend to settle down in a more orderly way. Computers do simulated annealing all the time. And if the world were perfect, then the coronavirus would be a total tragedy. But because the world is not perfect, there's an opportunity to use this disruption to make it better afterwards, rather than go back to the way it was. And this is mostly, I'm not stupid. The world is, pharma companies will still be trying to make too much money. Governments will still be trying to abuse their power. People will still be greedy. But at the same time, something like this does, number one, show the fault lines much more clearly. It makes people reassess their priorities. Ultimately, it has to make you think a little more long term. What am I, I didn't die. Why am I alive? What do I deserve? How can I make the world better for my children? There are very few people who don't at least think a little bit more about what the meaning of this all is. And so my goal is to take advantage of this as things accelerate, to kind of steer them in the right direction. And so, I loved the beginning of the tech industry. I was there right at the beginning. I loved the commercialization of space. I loved the discovery of the quantified self movement. But I'm thrilled with, for all the frustrations, and there are people who have no agency and who are desperately unhappy and in pain. And I don't want to dismiss that. But at the same time, those problems are being more recognized, and that is really important.
Thank you.
Esther, being the daughter of Freeman Dyson, the scientist, having that exposure to the world must have had a massive impact to what you're doing today. One question I have for you is, when you look at the COVID-19 and you look at the G7 countries, you look at France, you look at the UK, the US, and all of those countries with better health, per se, in terms of hospital, in terms of research, etc., have struggled a lot more than the less developed countries. What is that fundamentally telling you with the knowledge that you have?
It's telling me a bunch of things. One is, I really don't know the numbers yet. Nobody does. There's a lot less travel. The less developed you are, there's going to be the veneer of people at the top who travel and move around the world and so forth gets thinner and thinner. There's, it tells you that some of this, quote, developed world is pretty fragile. That people get more and more resistant to government control. At the same time, I also know that it isn't over yet. And so I don't really know what it tells me yet. I'm watching with great interest. I know there are lots of places where the counts are underreported, where there's not enough testing. I also know there are places that really are doing a good job of reacting and sheltering in place and avoiding contact and so forth. And again, now that travel is shut down, it's sort of easier to control your own space.
You in a recent TEDcast, you said that acceleration is an important piece of everything, and you also continue to say that to go fast, go alone, and to go far, go together. And I've heard this many times, and it'll be great to get some examples of where you've seen it. I think Wellville is probably the biggest example that you can give in terms of a 10-year vision, because too many people today, and they blame the age group, the millennials, the Gen Zs. They want everything very much faster, and don't have a longer vision. So, what's your take on this particular subject?
Okay, well, first of all, it's that saying is mostly attributed to Nelson Mandela. But he probably got it from his tribe or something. I mean, it's been around for a while. It's fundamentally true. You can go farther you can go faster when you're small. When you get bigger, you develop a lot of friction, and some of that friction is good. I mean, regulations are friction. The fact that you need the people in your company to cooperate. The fact that if you're going alone, you can't specialize, and you can't outsource to people who are better than you. So you really need both. But in the end, people don't live in a vacuum. So at some point, if you want to have impact, you have to spread it. You have to scale up, and then you have to deal with all the complexities and the friction and the slowing that scaling up creates. But it also creates inertia, and at both positive inertia and slowing down. I mean, once you've started going at whatever speed you're going together with lots of people, there's a forward movement that's much harder to stop. So, it's just like Christopher Columbus or something could go exploring and go very, very far, for better or worse. But in order for that to have any impact, many, many more people had to follow similar paths. And, it's just like politicians don't get anywhere unless they actually have a lot of followers in a movement.
So, I mean, now that you've mentioned politicians. So, your views on the future of the world. I mean, there are two very distinct thought houses. Like, one feel that in future we will have regressive nationalism taking shape across the world, and there are like eternal hopeful institutions and governments and people like us who say no, there will be progressive, collaborative world that we'll be living in. In your experience, where would we be in coming times?
I don't think the world's going to end.
That's for
and
sure.
so I don't think we're actually going to end up in either. It's going to be a continuing back and forth, here and there, move forward, regress. It's always going to be a dynamic balance. I hope it becomes a little more equitable and sensible, and more people move to the middle class, and at the same time remember where they came from. But it's not going to be smooth. That's pretty clear.
I traveled to South Africa, and what I loved about when I landed in Joburg was they said, "Welcome home." And I was like, "What do you mean?" It's like, all of you started from here, so welcome home. And it immediately made me feel at home. And I think, that kind of spread is much needed during intercourse as well.
Esther, we've got last couple of minutes left, and one question that's come up is with this, when you look at the global world in the last 30 years, you had the oil companies leading it, and the banks were driving it, and there was a switchover in the last 10 to 15 years with the tech companies driving and monopolizing the world as well, without controls almost. Do you feel that controls are needed for these large tech companies who are creating monopolies of the globe? And how do you make sure that all the good that's happening as well, the better health, the better connectivity, the better view of transparency, all of those things, how do we control to make sure that these companies are not monopolizing and killing the smaller companies and startups that are coming in each of these countries?
Yeah, and that's a really tough one. I mean, the oil companies affected the price of oil, and their product enabled us to drive a lot, but it didn't really change our human behavior. And that's the scariest things about the tech companies, because they interact directly with consumers and consumer behavior in a way that the old monopolies did not. So it's a serious, huge problem. The challenge is it's not that I want governments running things. I think antitrust, which is, even if it may not be as efficient, it is definitely, the more power you have, the more transparency you should undergo. And at some point, anybody having too much power just becomes a problem. I'm still not sure how or when to break up Facebook. Originally, until quite recently, I thought the best answer was for the market to do that by somebody else coming up in their place. And I'm still not sure, but I think fundamentally, all these companies started with somebody's DNA. They had this mission, this idea, but then ultimately the metabolism takes over. And the metabolism is investors and profit seeking, and this, just like people are addicted to drugs and foundations, nonprofits are addicted to grants, these companies are addicted to growth, not just to income, which is fine. You need a profit to keep doing it, but to grow exponentially makes you start to misbehave, like Amazon also. And the challenge is, I dealt with this at ICANN as well, the domain name system. Yeah, it's not as if there was somebody better waiting in the wings that I want to give the power to. How do you distribute power and not let it get so centralized is really probably the biggest challenge the world will face after coronavirus, and it's a long-term challenge.
Thank you, Esther. That's a great way to end tonight's session. So any final words from Faraz or Esther at this point?
Just good night to you all, and get a good night's sleep.
It's been an absolute honor to have this conversation, and thank you so much on behalf of all the South Asian viewers across Sri Lanka, India, Bangladesh, Pakistan, and great insights. And hopefully, when Nathan will invite you to Sri Lanka again, there'll be an opportunity to meet you as well.
I look forward to that. Thank you all. Thanks, everybody.
I just want to thank Hatch team, the BYLC team in Bangladesh, Seed Ventures in Pakistan, and Pro Pakistani, as well as Hatch Pakistan, for putting this together. We will have another session same time next week, and next week we have Anjali Sood, the CEO of Vimeo, with us to talk about the Vimeo platform and the impact it could have on Asia and South Asia specifically. But Esther, it's been a privilege, as usual, just to see you, first of all, and speak with you. And thank you for imparting all of that knowledge back on South Asia. We hope that we can have you back on at some point again when things are in a better place. Thank you.
And maybe you and I can be in the same place.
Yes.
Thank you very much.
Thank you.